My name is Lola, and I have been a nurse for over 25 years, and I have worked with a variety of patients in many settings, including the hospital and dialysis units. So, the Varicella Zoster virus is one of 8 herpes viruses known to infect humans, and it causes chickenpox in children, teens, and young adults, as well as herpes zoster, better known as shingles, in adults. Once a person has recovered from the chickenpox, the virus can remain dormant for a number of years in the body. It may also reactivate to cause any number of neurological conditions. So one of those conditions is herpes zoster, better known as shingles, and that can happen in up to 10 to 20% of cases. Chickenpox, or herpes zoster or shingles, causes a person to get lesions, kind of like blisters, that are highly infectious when they ooze. So you can get the disease by contact, or also by the person coughing or sneezing, and they can transmit that virus to other people very easily. There are a few things that we can do. Some of them are not so easily accomplished. For instance, isolating somebody with the active form of the disease, somebody who's got lesions that are oozing. We can isolate them from other people. We can have people be really clean, wash their hands or wear a mask when they cough or sneeze, but that doesn't always work either, as we know. Also, unfortunately, we don't always know when we have the disease because it's not so readily diagnosed early in the process. So we can be spreading that infection when we don't even know we have it. So the actual best way to prevent the transmission of the disease is getting vaccinated. So the vaccine itself is an attenuated live virus, and some people think that if you get this vaccine, you can actually get the disease or get chickenpox from it, but that's really not true. There have been cases where you might get a breakthrough incidence of disease, but generally if that happens, it's mild in nature. So getting vaccinated, it's recommended that 12 to 15-month-olds get vaccinated with their first dose, and thereafter it's followed up when they are between the ages of 4 and 6 years old. Once the vaccine was approved in the United States in 1995, the number of cases of varicella went down, and the number of hospitalizations and associated deaths with varicella went down as well. There are various states and mandates requiring vaccination against varicella, and for instance in the state of Connecticut, students are mandated to be vaccinated or show proof of immunity through exposure to the disease upon entering kindergarten, or even young adults upon entering college. Patients and healthcare providers in general are not mandated to be vaccinated. But sometimes what can happen is that in a healthcare setting or in a hospital setting, a patient may enter the hospital and be admitted with chickenpox. And let's say we have a staff person or a nurse who is pregnant and planning on caring for that patient. We would then not have that nurse take care of that patient. Rather, we would have somebody else who has proven immunity and is not pregnant taking care of that patient. Unfortunately, most people are immune. 90% of the United States population is immune to chickenpox, and that's a good thing, which means that most pregnant women are immune. But for those who are not, and they know they're not, and they are pregnant, chickenpox can have serious consequences, both for the pregnant woman herself, as well as her unborn child. Pregnant women who are not immune and contract chickenpox, in 10 to 20% of cases, they get pneumonia, and they can have risk of death as high as 40%. 2% of cases that the unborn child can contract something called congenital varicella syndrome, This means that that baby can have a low birth weight, have problems with their legs, their arms, their brain, and even their eyes. So it's really important for the pregnant woman to stay away from people with chikungunya.